Nothing compares to the moment when a woman becomes a mother, but unfortunately, not all birthing experiences are created equal between women of different races. Kimberly Seals Allers, who is a maternal and infant health strategist, spoke with mom-to-be Lindsay about birth equity and what's being done to even the playing field. Take a look.
Kimberly Seals Allers, welcome to DBL.
Thank you so much for having me.
Thank you for joining us. So I'm about to be a new mom, and I've definitely heard about the differences in maternal care between white and black moms. It's been something I've been worrying about the whole pregnancy, but can you tell me and point out to our audience what those differences really are?
Well, first of all, congratulations.
Thank
so
you.
happy for you. It's a joyous time, and I want you to really soak that all in. But on the other side of that, I should say, with that is the reality that black women are disproportionately dying during and after pregnancy and childbirth. This won't happen to you. But what we do know is that racism and bias in our care is one of the root causes of these disparities, right? According to the CDC, black women are 243% more likely to die during pregnancy or childbirth.
Now, I know that a lot of the stories are that the doctors don't listen to black women when they tell them that they're having issues or complications. So are there reasons why black women are more mistrusted than their white counterparts?
I think we really have to understand the history of the obstetrics and gynecology field, that it was really rooted in racism and a field that was built literally on the backs of black women. For example, Dr. Marion Sims, who is known as the father of gynecology, very well respected in that field, really became famous by using enslaved black women as subjects for his surgical procedures. Obviously, they did not give permission. There was no anesthesia. And then we can look even more recently. There was literally, quote unquote, science that said that black women did not experience and feel pain the same way that white women did. This was being taught in medical schools. So these racist ideas and racist systems are part of the medical system, unfortunately, and even part of the quote unquote research that was supposed to be used in managing our care.
Now, Kimberly, I know you're a mom too. So what was it like for you? Did you get treated this way in your hospital experience as well?
I went to this hospital, really left feeling traumatized. Obviously thankful that my baby and I were alive and safe, but was completely disrespected. I had a C-section that I'm still not able to fully explain. I literally fought to have my baby with me when I had read that this was a standard practice of care at this hospital. I wanted to breastfeed, and my baby was repeatedly given formula against my wishes. And it was really like I was in a fight for everything.
Right, I'm experiencing that now. There are hospitals that have rave reviews, but really I have to know where I can feel comfortable as a black woman, so I completely understand that. Your own maternity experience led you to create your Irth app, which I love. So let's talk about that and tell our audience what it's all about.
Well, it's called Irth, which is like the word birth, but we dropped the B for bias. And Irth is a Yelp-like review and rating platform for black and brown parents to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians up to baby's first year. We really want to show specifically the behaviors that black and brown people say are disrespectful and give that information to providers and hold them accountable to do better.
It's so important because I remember when I found out I was pregnant, the first thing I was like, what groups can I join? Who can I talk to? Who can find me an OBGYN in a hospital and everything that I can trust? So it was a long process, and I wish I knew about your app 7-8 months ago, but now I found out recently and I'm all over it. So Kimberly, thank you so much for sharing your story and all the important information on the Irth app. DBL Nation, make sure to pick up a copy of Kimberly's book, The Big Letdown, and definitely check out her podcast, Birthright. And of course, don't forget to download the Irth app. Kimberly Seals Allers, it's been a pleasure. Thank you so much for joining us.
Thank you for having me, and have a joyous birth.
Thank you.